Well, this all started on January 22nd during the terrible snowstorm. And for some reason, I went out and thought I needed to shovel. My wife was not supposed to be there that day. She was supposed to be at work. I didn't have a pulse. I was not breathing. My lips were purple. I was very gray, ashen looking. And I was dying.
So I was working that day, so I'm a nurse here, and I got the phone call from my mom that he was not breathing and that she had called 911. And with that terrible snowstorm that day, I didn't have much hope.
The paramedics, when they pulled up, they were wondering how they would ever get me out of there because the snow was so deep.
That was the longest, probably 30 minutes of my life waiting for him to come, because knowing what I know medically, I didn't think there was any chance of him surviving. Once he arrived, there was probably 30, 40 people in his room working on him. But at that time, I also felt confident because I saw how dedicated they were to saving him for us, and they did.
What I had was a fatal arrhythmia, where your heart's electrical system goes haywire and it doesn't allow your heart to pump blood.
So in a situation where we have a patient who's presenting with out-of-hospital cardiac arrest, we have an entire team that gets activated in a very synchronized fashion. So there's myself as the physician, we also have nurses, technologists, a lot of support staff, paramedics, and all of these people really get activated essentially in a synchronized or simultaneous fashion.
You just don't think anything's going to get you, and it can happen at any time. It really can, and I learned that the hard way. It can happen.
Seeing what a big impact everybody here at UnityPoint has had on our family to get our dad back is amazing, and it just feels great to know that I work here, and it makes us proud.
I think people should be very reassured of the care that we have here at St. Luke's. We have all the components in place. We have excellent physicians, excellent nurses and technologists, and support staff, and all the mechanisms are here in place to manage heart attack, even of a complex nature, as well as out-of-hospital cardiac arrest.
I came in on my back and left on my feet. And it was through hard work of the employees to get to that stage, to be able to do what they did and also to think on their feet. And I'll be eternally grateful.